Chelsea. Today I'm here to talk to you about, give you an informed discussion about vaginal and cervical swabs for sexually transmitted infections.
Okay.
I understand that you had mentioned that you had chlamydia about 12 years ago.
I think it was 12 years ago.
Okay. Now, do you remember if you were treated for it?
Yeah, I know that I had a test and then they gave me medicine to take and I took the medicine.
Okay, and did you have it? Did you have a test done again afterwards to make sure that it was gone?
Oh no, should I have done that?
Yeah, we usually try to do that, particularly with chlamydia, because chlamydia can be asymptomatic, and so even though you probably went to the clinic because you were having symptoms of chlamydia,
Okay.
sometimes chlamydia can be asymptomatic, which is why we test for it in pregnancy.
Okay, so I could have chlamydia now and not know it.
You could have it now and not know it. In
Okay.
fact, about between 70 and 80% of people who have chlamydia are asymptomatic.
Okay.
So the other thing that we test for is we test for gonorrhea as well with the vaginal swabs.
Okay.
And so what the swab involves is just inserting a cotton swab into your cervix and taking some cells from there and trying to collect, if there is any bacteria, we will try to collect some bacteria from there.
Okay.
And what the test does is we then send the test off to a lab, and the test is looking for live bacteria that would then grow in the lab setting, and then we'll get the results back fairly quickly.
Oh, okay. So you do that here?
Well, we do the swabbing here,
Okay.
and we usually do it, it is a vaginal exam. We do test everybody for this disease and for these infections, and a big part of the reason for doing that is because in pregnancy, these infections can cause premature labor, they can cause ectopic pregnancies, and they can cause infertility, which clearly is not a problem for you.
Okay.
But it is something that can have fairly significant impacts.
Okay.
And it can lead to pelvic inflammatory disease, which is something that we're trying to avoid.
Sure.
The other thing is that if you have an active infection at the time of delivery, about 50% of mothers who have an active infection will pass that infection on to their babies. And that infection can take the form of eye infections or lung infections, which could result in blindness or in pneumonia, which are things that we just want to save you from, if at all possible.
Okay, that makes sense.
Particularly because chlamydia and gonorrhea are very easily treated with antibiotics. Chlamydia is easily treated with azithromycin, and gonorrhea is easily treated with antibiotics as well, although it can be a little bit more sensitive. There's a little bit more antibiotic resistance in gonorrhea.
So if you were going to test me for those things with a swab, would they be able to tell you, like, if the medicine would work to treat a strain that I might have?
Yes, they would be able to tell you that, because we could test which type of strain that you had, and then we would be able to see if it was the antibiotic resistant kind, or you're not allergic to penicillin or anything like that. Okay, great. The other thing I wanted to just, we do test people early on in pregnancy, and then if you have more than one sexual partner, if you are in a high risk category, we would test you again at 28 weeks just to make sure that you hadn't obtained an infection at some point in time over your pregnancy. The other thing is that if the test comes back positive, we would treat both you and your partner.
Yeah.
Just to make sure that
makes sense.
Yeah. Now there is an alternative to the swabs, which I must admit is something that we've been doing at our clinic, which is a simple urine test, which tends to be a favorable test for people in that it's just easier to pee in a cup than to have the cervical swabs done. And where historically we were looking for live bacteria, we no longer need that. The labs are able to look in the urine and see and find bacterial DNA, and they're able to make a positive test from there. And the urine test is as effective as the urine screening is as effective as the vaginal and cervical swabs.
Okay.
Yeah. Now, do you have any other questions for me about this?
Well, how long does it usually take? Like, was this a thing where if you got the results back, you would have to call me, or?
I would definitely call you, and it's also something that goes on to the Ministry of Health, because they are tracking these infections, in part because these are two of the most common sexually transmitted infections that we see.
Okay, and then if you were to send that to public health, would they have a record then of the last time that I was treated for chlamydia?
That's a good question. Yeah, they do. They do. They will have.
So we can double check then to see, because I don't really remember when it was, but yeah, it would be good to know.
Yeah, it would be good to know.
All right.
Great. Okay. Well, good luck with it all, and why don't we just have you pee in a cup, and we'll send off the sample to the lab.
Sure, I can do that.
Okay. Great.
Okay.
Thanks very much, Chelsea.
Thank you.
Bye bye.